Managing pain sounds responsible. It sounds sensible. It sounds like the right thing to do. But for most people, it's the exact reason nothing ever really changes. And if you've ever felt like you're doing everything that you should, yet you keep ending up back in the same place, this episode will explain why. Welcome to the Back Chat Beyond Pain. This podcast is for people who are tired of chasing short-term relief and want something more. Each episode, we break down what it really takes to move better, live stronger, and build long-term spinal health, not just feel good for a moment. I'm Dr. Oz from The Back Doctor, and this is where we go beyond pain. So in the last episode, we talked about why feeling better isn't the same as being better. That idea alone challenges how most people think about their health. Today, I want to take you to that step, one step further. Because the reason so many people stay stuck isn't because they're lazy, careless, or doing nothing. It's because they're doing exactly what they've been told to do. And unfortunately, that system is flawed. So we are talking about healthcare actually being sickness care. There is a big comparison between the two. So here's the pattern. Here's how I like to separate the two. Pain shows up. You take action. You get relief. You move better. You sleep better. Life feels manageable again. And once the pain settles, life takes over. Work needs you. Family needs you. Training, chores, stress, it all piles back in. And because the pain is gone, nothing feels urgent anymore. Does that make sense so far? So now the weeks pass, the months pass, and then one day the pain is back. And when that pain comes back, guess what you do? You go for a quick relief. And when you get that quick relief, you repeat the same cycle. You're feeling better, you're back to daily life, you're doing the same things, and then the pain comes back again. What happens now? Does it stay the same? Or over time, do things get worse and worse and worse? So this is the tricky part, because the pattern itself feels sensible. The pain shows up, you respond, the pain settles, and you move on. That's how we treat most problems in our life. If the headache goes away, we don't keep thinking about it. If a warning light turns off, we assume everything is fine. But the body doesn't work like a simple on and off switch. And that misunderstanding is where people get stuck. There's another reason managing pain feels so appealing. It feels safe. Managing pain doesn't ask you to change much. It doesn't ask for consistency once things feel okay. It doesn't challenge habits, routines, or identity. It lets you say, I'll deal with this later. And that's not a character flaw. That's human nature. So safety and progress aren't the same thing. Doing only what feels safe often keeps you exactly where you are. So the problem isn't back pain itself, or isn't pain itself. Pain is feedback. It's information. It's your nervous system saying, something here needs attention. It's your warning signal. We talked about the check engine lights. That's a great analogy, but I'm going to give you another one. Think of it like a smoke alarm going off in your house. The alarm is loud. It's uncomfortable. It gets your attention, and it's annoying, frankly. But turning the alarm off doesn't fix the fire. It only stops the noise. But most people do is they grab the smoke alarm, pull the batteries out, and problem solved. And if we ever just silence those symptoms, the underlying problem never actually changes. And remember, that damage over time is going to get bigger and bigger until it's not fixable. So when pain is the only trigger for action, care becomes reactive. You only respond once things hurt. You only stop once they don't. That means the body never gets the chance to truly adapt. Stability isn't built in emergencies. Strength isn't built during flare-ups. Resilience isn't built in crisis mode. So the same stress patterns keep loading the system. And each time the pain comes back, it tends to stay longer, feel stronger, be harder to shake, not because things are worse, but because nothing underneath ever changed. I hear a version of the same story again and again. Someone says, I need to get myself sorted, and then I stop. And it's not because they don't care, or not because they don't believe in it, but because life gets busy and they feel okay. Then months later, they're back saying, I don't know what happened. What happened is nothing dramatic. They simply stopped halfway through the process. Relief came, but change never finished. The underlying structure never got fixed. This is the part people don't talk about enough. Living in this cycle slowly erodes confidence. You start to doubt your body. You hesitate to commit to things. You plan life around, what if it flares that up again? What if it doesn't get any changes? I've been burned in the past before. And that's not just physical, that's exhausting. And it's completely understandable. Now, this is the good news. In this cycle, it can be broken, but it requires a different way of thinking around health, not as something you chase when things are wrong, but something you build steadily over time. And that shift changes everything in the long run. So if you're listening to this right now, it's worth asking yourself one simple question. Have you been managing pain? Or have you been building your health? Because those two paths, they look similar at the start, but they lead to two very different places. One keeps you reacting, and the other helps you move forward. And recognizing which one you've been on is the first step out of that cycle. So remember this. Managing pain keeps you busy, but changing the system is what actually moves you forward. And once you understand that, you stop going in circles. So if today's episode resonated, take a moment to let it sink in. Feeling better is a step, but lasting health is built over time. And if there is someone who resonates with you that needs to change their health around, please share this podcast, share this episode, share it with them, get it out there. And thank you for listening to the Back Chat Beyond Pain. Until next time, keep moving forward. Take care.